This is Dr. Roger Knapp, a pediatrician. I'd like to talk to you about injuries, and now I'm talking about sprained ankles, jammed fingers, twisted knees are more typical, but it could be elbow or any place. When we injure our body, a lot of times, if you've ever seen sprained ankles, jammed fingers, boy, they swell up pretty quick within the hour and frequently get black and blue, because when we do that, it's actually bleeding inside the joint. Inside the body tissues. And blood is important in our blood vessels, but outside the blood vessel, it's like battery acid, and blood damages our body. And that's why a lot of ladies can tell they ovulate, because that one little drop of blood in their stomach. And the situation where we injure it, we treat that in 4 ways, and it's to try and cut down the swelling. And it spells the word RICE, R-I-C-E. R for rest, I for ice, C for compression, and E elevated. Of all of these, though, we're trying to cut down the swelling, but the swelling is caused by bleeding. If you cut your leg and you're bleeding, do you put ice on it? No. You hold pressure to clot the artery or vein. So when we injure your body, of all those 4 things we treat injuries, actually the most important and the very first thing you should do is compression. Wrap that joint in tape. ACE wrap will still stretch and allow it to expand. So the ankle, knees, and things, wrap it in tape. In fact, a lot of football players on the National League, they wrap their joints in tape before they play because they know they're going to get hurt. And you leave that tape on for 24 hours. After you apply tape on it, then if you want to put some ice on it, that's fine. But in fact, even if you want to go back in and play more sports in the game, you can. But the first thing coming off the field, right away in pain, wrap it in tape. White athletic tape from the trainer, duct tape from the trunk of the car. You know, us men, we like our duct tape. Then leave that tape on there for 24 hours, and the recovery time is a lot shorter in coming back to full activities. And even if that bone is broken, it's still going to heal quicker if it's less blood in there. So we want to try and can talk people into going more towards wrapping the joint, because we were taught for years to run for the ice and put ice on it. And it's okay to put ice on it, but that's not the first thing you do. So wrap that joint in tape. Same thing when the tiny infant toddlers, 1 to 2-year-olds, fall, hit their head and get a goose egg. It comes up fast and swells and gets black and blue. So that same thing there. Just grab their head and hold pressure for a minute. And how many times you and I have bumped our head and you pressed on it and it made it feel better. So the infant is not really, it doesn't understand what you're doing, but you're going to make it feel better. And then you get a little tiny bump instead of a huge goose egg. And so actually same thing there. And there's another article that I've done, a video on head injuries, and you may want to listen to that as far as infants and head bangs. So when your joints get hurt, wrap it in tape. Thank you. This is Dr. Roger Knapp.